Namaskar. Welcome to Ahara Arogya Adhyatma, the light of samskara. Today we have a renowned and very famous orthopedic surgeon, Dr. Vinay Kumar Swami. He did his MBS as a meritorious student from Bangalore Medical College, the Government Medical College, and then he did his MS Orthopedics from Banaras Hindu University. And after that, he got the special training and fellowship in the arthroscopy as well as for the sports injuries. And on top of that, he went to UK from Manchester. He did his fellowship in the upper limb surgeries also. Thousands of surgeries he has done, and he is very famous. And right now he's working in Bangalore, and he is specialized in the sports injury. Today he is going to tell us about what are the sports injuries and how they are treated, and then how to prevent them. Please welcome Dr. Vinay. What are the sports injuries and how they are treated, and then how to prevent them? Please welcome Dr. Vinay. What are the sports injuries and how they are treated, and then how to prevent them? Please welcome Dr. Vinay. What are the sports injuries?
Thank you, madam. Very big thank you for having me on the show. Yes, sports are a part of life. They say life itself is a sport and it should be led as such.
That's good. Excellent. Excellent.
So,
Okay.
all of us should be involved in some sport or the other, from a teenager to a young kid to our adult age also. We should be involved in sports. Sports help keep our bones, joints, muscles healthy.
Not only adult, even when you grow old like me, I have
Absolutely.
run the marathon in the
Lovely.
Miami Beach, so we
Oh,
have to
lovely.
continue being sportsman. Yeah.
But injuries are a part of sport. Whenever an injury happens, we ask our athletes and people to follow four rules. Whenever injury happens, you have to use RICE. RICE,
Okay.
RICE, rest. You have to rest that part, not use that part much. Ice is ice compression.
Ice
C
pack.
is ice packs. C is compression. One can apply a crepe bandage or
Crepe
a belt
elastic
around
bandage.
that to reduce the swelling. E is elevation. We need to keep that part elevated. A hand can be kept inside a pouch. A leg can be kept on a stool in front, or one can lift the hand up and keep
Lift
it
the
like
hand
that.
and then keep on moving. Okay.
So the most important treatment for injury is RICE, rest, ice, compression, elevation. And 95% of the sports injuries heal with this. And only 5% are the ones who need to visit a doctor for their sports injuries. And the red flag signs for visiting a doctor is if you're not able to walk after, say, 1 week of rest, also you're not improving, not able to get back to your regular sport. Then
And the pain is unbearable pain.
absolutely, absolutely. Unbearable pain, lot of swelling. Okay, something which is alarming, lot of redness in that area. You should visit your sports injury specialist or orthopedic surgeon at the earliest.
Okay. Now, if this is enough, it's okay. In case, they want to mobilize fast and they have some target, they have to go to some place and they have to recover very fast. And in that case, what do you advise them? And once you know that there is some serious injury has occurred, what are the options?
Most important part of examination is the clinical examination. Good doctor can pick up most of the things with clinical examination. In some cases, like ligament injuries or fractures, we get X-rays done. We get an MRI done to find out about ligament injuries. Ligaments are what connects two bones with each other. This is a model of our knee joint. This is the thigh bone, that is the leg bone. What connects the two bones is called a ligament. Now that orange color thing is a ligament. Ligament is like a chain in a bicycle. This is one tire, this is the other tire. If there is a disconnection of the chain, then we need to get an MRI done for those cases. For severe injuries, sometimes we apply a plaster. Only 2% of sports injuries would require a surgery to correct the part that is injured.
No, many times we say that the sports injuries when they fall or when they injure. But when Imran Khan was the captain, I remember when I was a child, he had a tibial fracture. It is because of the stress, they said. Is that true?
That is true. That is true. Stress fracture is also common cause of injury. Fractures can happen in two ways. One is an injury at that moment. That injury at that moment caused the injury. Stress fracture is something which accumulates over a period of time. for more than 1 month. They've been running more than what their bones are able to handle. So
Especially
that
the
cumulative
fast ball,
growth also.
they run long distance. Yeah.
Yeah, Jasprit Bumrah is famous for having stress fractures in his lower back. That's why Indian
Oh,
cricket team is managing him like a flower now. So stress
okay,
fracture is because of a
okay,
repetitive injury.
okay.
It
No,
takes longer for a
no.
person with stress fracture to recover compared to a normal fracture.
I see. And in order to see that they are stronger and better, is there a special training given to these people to prevent the injuries? How exactly they have to prevent the injuries?
Yes, madam. Prevention of injury is the best thing if we can do that. In treatment is always a little more expensive and a little more taxing. Most important is to maintain the hydration adequately, drink adequate liquids so that you don't get dehydrated. That is a big cause of injury. Warming up your body and stretching and cooling down is very important. Cool down is something which we frequently forget, especially our recreational athletes. So you go play badminton till the nth minute, get onto your bike and then come back home. That is very bad. You got to keep your last 10
Okay.
minutes for stretching your muscles. So if you
Oh,
stretch your muscles, then the chance of injuries are much lesser.
okay.
So that is one thing, and strength and conditioning intermittently, lifting weights and doing some strength training will add to your strength, and injuries will happen less frequently.
Okay. If there is a
Weights and doing some strength training will add to your strength, and injuries will happen less frequently.
meniscal tear or the ligament tear or something serious has occurred, and their restriction is there and they are not able to, pain is not coming down, what type of surgery do you, is it an open surgery or a keyhole surgery?
Most of the surgeries in the joint we are doing these days is arthroscopic surgery or a keyhole surgery. What we do is we make a small hole in the skin and put a video camera into the joint, and the picture
Okay.
comes to you. Look, we can finish off the surgery. The advantages
Okay.
of arthroscopic surgery is there'll be a smaller scar, patient has
Okay.
less pain, they recover much
Okay.
faster, and we can do a
Okay.
more precise and a more accurate job because of
Yeah.
improved visualization with the help of a camera.
Yeah. Because literally you're looking into the injury, so you know where to repair and how to repair. So you are more accurate and precise. So you are specially trained in that. And that is really wonderful. In fact, younger generation should take up for the sports, because now the obesity is increasing because the children are not playing. And I would say that those who are lazy and lie down, they will fall down from the bed, but those who are old like me, they'll fall down in the bathroom and injure. But the children, they fall, but they recover very fast. But they should have
Absolutely.
activity. And unless the
Absolutely.
physical activity is there, and I say that studies and the thing both are like two eyes. Arta pata, the two have to be together. Otherwise, the children all round development will not be there. So you are a marathon runner. How did you manage? Please show how many medals
Uh,
you have
uh,
got.
I am a full marathoner. Full marathon is running 42 kilometers. So there are a lot of
Okay.
medals there. Some 8, 9 of them are full marathon. This is a great conversation starter. This is in my clinic. This inspires my
Okay.
patients also that my doctor is only not coach bar, and he does not only preach, he also does what he
Yeah.
preaches. So
Okay.
we as doctors need to set examples. Only then patients listen to us. That way we are setting
Yeah.
an example also. So I am an athlete, I'm a full marathoner, and injuries are a part. I've had injuries and I've recovered well from there.
So you have had the injury and recovered too. So you have experienced that also. Excellent. It is really wonderful to be a sportsman.
Absolutely.
The sportsman, it is not just the physical activity. Your mindset will be different. You have developed the sportsman spirit and you take the life, whether injury or no injury, win or the lose, you start taking in a right
And
perspective. And I think you can make out, by looking at you, you are the fitness freak and then you are so fit, and that's really nice. And it is so important that all the parents should encourage their children not only to study and get marks, don't make them markswadis, but make them sportsmen, And then even if they don't become the champion, at least, they'll be physically fit, and then, they'll be able to do better work in it. Because, like in the cath lab, I used to stand with that 10 kg lead coat for hours together from morning till night. And in your case also, but to operate, you have to stand for hours together. And that stamina you get when you are a sportsman. So I think mentally you have to be strong, for that yoga, and physically to be very strong sports. And apart from that, we must be good in our studies and precise in whatever diagnosis we make and treat. And thank you very much, Dr. Vinay, for you being the sportsman and you having got the injury and trained in that. And you are the right person to tell our audience what are the sports injuries. Thank you very much.
Thank you. Thank you.